Hi, and we're in Psychology2, and we're going to look at the chapter on therapies. And because we're going through this difficult time with the COVID-19 virus, so bear with me. I'm going to try and get all this particular chapter done in one video. It'll be a longer one than usual. However, it'll help you condense things down and get things done and make sure you get everything in on time and to get things done. So keep clean, wash regularly, wash your hands, use soap 30 seconds or more, and keep your social distancing. Keep track of and follow up with checking your emails for any updates coming from the college. Okay? So let's get started with this particular chapter. Now, on the surface, clinical psychologist Kay Redfield Jamison seemed to have it all. Good looks, plenty of friends, supportive family, and a promising future as a psychologist. She was bright, energetic, vibrant, and gifted. On the surface. Now sometimes Jamison was too bright, too energetic, too vibrant, and then sometimes she was not. She was the opposite, in fact, depressed, lethargic, willing to wilting into the abyss of pain and nothingness. Now, Jamison knew the details of her academic specialty, mental illness, was far too intimately. She knew she was bipolar. In a 1995 memoir of The Unquiet Mind, Jamison, a psychologist and professor of psychiatry at Johns Hopkins University, recalls her struggle with the debilitating mental illness that threatened both her livelihood and her life. Now, as a graduate student at UCLA in the mid-70s, Jamison experienced dramatic mood swings that made her fun-loving and buzzing with creativity one minute and deeply despondent the next minute. And like many other sufferers of bipolar disorder, Jamison was at first afraid to admit that she was sick, and secondly afraid to get help. Now, despite her qualms, however, Jamison did seek treatment. Under guidance and supervision of a psychiatrist, she began to take lithium. Lithium is an elemental salt that controls bipolar mood swings for many sufferers. Lithium wasn't magic, for Jamison, but therefore unpleasant side effects. And in truth, Jamison missed the mania sometimes. Sometimes that does happen with people with bipolar, as they get to accept mania as being kind of desirable and normal, and depression is the bad part. And sometimes that surge of energy she gets out of the mania made her feel unstoppable, invincible, and electric. Now, several times Jamison even stopped taking medications, which again isn't always all atypical, only to find out that without it, she would quickly spin out of control. As difficult as it was, Jamison eventually realized that in order to continue working and living, she needed to continue testing for her illness. So treatment allowed Jamison to continue her pursuit as a researcher, an author, professor in the field of psychology. Her book, Manic Depressive Illness, is a classic textbook on bipolar disorder. She was chosen by Time magazine as a hero of medicine, and she was in 2001 MacArthur Fellowship recipient. So Jamison has dedicated her life and her career to unlocking the mystery surrounding mental illness, helping countless other sufferers in the process. Jamison's recovery from and maintenance of her illness, in addition to her long list of professional accomplishments, is a testament to the belief that with proper treatment, people who suffer from psychological disorders can take their lives back. And so in this particular chapter, we're going to review a variety of different perspectives of therapy. And we're going to start with psychotherapy. Psychotherapy involves a person talking to We'll start over. Okay. We're going to start with psychotherapy. Psychotherapy involves a person talking to a psychological professional about a person's problem. Now, psychotherapy for the purpose of gaining understanding into one's motives and actions is called insight therapy. Psychoanalysis, person-centered therapy, Gestalt therapy are examples of insight therapies. They emphasize the role of understanding our psychological well-being. Now, we're going to identify 4 basic techniques of psychoanalysis and how they are used to help patients. Now, the 4 techniques we're going to look at will be free association, analysis of resistance, dream analysis, and analysis of transference. And they're used to uncover repressed memories, impulses, conflicts presumed to cause the patient's problems. Now remember, with psychotherapy, their exploration is to the unconscious, the underlying conflicts that exist that might produce themselves as a psychological disorder. So they're looking to dig down into childhood experiences and look and see where might the cause of some of these problems exist, that by fixing these, that's where we go. So we'll start with free association. Free association, saying whatever comes to your mind in order to reveal the unconscious. So essentially, the therapist would give you a series of words, and you're just to go bang, 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 without really thinking, just pop out the word that comes next. And then that sort of relationship between the test word, or the word they've expressed, and your response allows there to be some awareness about what underlying things that your unconscious pushed to the front might there be that we could look at. Analysis of resistance is pointing out the client's attempts to resist therapeutic breakthroughs. So as we move towards making gains, sometimes a patient withdraws or resists. And so they're looking at, so what is it about that resistance that we need to explore? Dream analysis is looking for the underlying or latent content within dream symbols. Now, there are many theories about dreams and what dreams mean, and from this perspective they're looking at how might dreams, from the philosophy of it's working out problems to sort things out, and dreams is a way of doing that, how might the symbols that evoke out of a dream might represent the unconscious mind. And then the last point around analysis of transference, here's where the client tends to transfer their positive and negative feelings onto other people, about other people, onto the therapist. So the therapist can direct that person's response to some of these transference and these emotions, positive and or negative. So that's essentially a really quick summary of psychotherapy and insight therapies. Let's now touch on the humanistic approach to therapy, and the one we're going to focus on is Person-Centered Therapy by Carl Rogers. This is a non-directive therapy. You'll hear this term directive. Non-directive just means that the therapist isn't directing the therapy and getting the client to do different things or pursue different paths. It's non-directive, so they're not directing the client to do anything. They're listening. In which the therapist provides an atmosphere of unconditional positive regard, that as much as I don't direct you, I try to create an atmosphere by which you are value, I'm of value, together we will just talk, and I will unconditionally positively regard you. Clients are free to be themselves, therefore, so that's their natural tendency towards a positive growth that can be released. That if you are well received in positive regard and you're allowed to pursue your interests, clients will then feel themselves move towards more growth. Now this certainly takes time, and then there are some basic elements to this as well. One would be a reflection of the client's statement by the therapist. So essentially the therapist restates or repeats the client's feelings. It was renowned to be known as "what I hear you saying is," and then repeat that statement. It gives that statement back to the client for them to reflect on and see if that in fact represents, or maybe that brings additional insights because it's well received. Also, not just reflection, but unconditional positive regard is given to the client by the therapist. Acceptance of the client. And that becomes really important to gain a level of atmospheric trust by which other things can be shared. Thirdly, empathy of the therapist for the client. That's the ability to put yourself in the client's position. Now, it's important for me to note here that that doesn't mean the therapist goes about saying how I understand what you're experiencing. Empathy is not you understanding somebody else. It's you giving them some appreciation that circumstance. Not that you understand it, because unless you've lived that exact experience, you can't understand it. I have cut myself before as you have cut yourself before, and I can say maybe I understand. But my experience of that cut and the pain and the recovery is different from yours, and therefore, really, it's not the same. We can appreciate the experience, but not necessarily understand. And then the last part is authenticity, for the therapist in the client's perception about being real. And that's an important element to the humanistic approach in person-centered planning, or person-centered therapy, Now, Gestalt therapy by Fritz Perls emphasizes the importance of the clients fully experiencing in the present moment their feelings, their thoughts, and their actions, and take personal responsibility for their behavior. Now, Gestalt therapy has key elements as well, and they include that it's more directive and helping clients to become aware of their feelings and taking responsibility for their life choices. So you can't say that it's other people's faults. You can only acknowledge your role in all of that. Gestalt therapy, therapists try to help the client deal with things in their past that they have otherwise denied, sort of unfinished business. And they'll use body language and other nonverbal cues to understand the client, what they're really saying. Now, that certainly requires an awful lot of experience on how to calibrate your ability to determine what any nonverbal behavior is being expressed by somebody means, because you need to know the context to understand the meaning. So that takes time to develop that relationship. Now, on the notion of relationship is another category of therapies, and those are relationship therapies. Relationship therapies look at individual struggles and the interpersonal relationships within an individual's lives. So we'll start with what is known as traditional couple therapy. And the focus here is on the identification and modification of behaviors that contribute to the couple's conflicts. So the therapist would observe interactions between the couple to assess the accuracy of these complaints that they've come forward with, and to identify each spouse's communication strengths. The therapist would work with each individual to modify behavior that contributes to the communication difficulties, and then over time that would get improved. An alternative would be integrative behavior couple therapy. Now here they target emotions as well as behaviors. Problems arise from changeable behaviors and the less changeable personality traits of both partners. Therefore, the therapists work with the couple to help them accept and adjust to each other's personality rather than trying to change it. And so then the focus becomes on the behavior, and those are more changeable. In addition, there is also family therapy, which involves the entire family, with the goal of helping family members reach agreements on changes that will help the family unit improve communication problems and create more understanding and harmony within the family. And so this doesn't look at the individual as having a problem or as the problem and therefore only needs to be corrected. It looks at the family unit and how can the family unit cooperate towards these improvements. Group therapy is another form of therapy that is less expensive than individual therapy, and it gives people a sense of belonging, an opportunity to express feelings and get feedback from one another. And it gives and receives, by giving and receiving, people get the emotional support that they need and get to feel like they're being a contributor as well. Now, it can decrease feelings of shame, anxiety, and depression to know that there's other people who experience what you are. And it can increase self-esteem. There are couples of other forms of groups that we're going to look at. One is called the encounter groups, and the other are self-help groups. And we'll do a quick review of them as well. Encounter groups, these are intense emotional group experiences designed to promote personal growth and self-knowledge. Participants are encouraged to let down their guards and relate honestly and openly to one another. Now, self-help groups, these are usually led by non-professionals. It's usually not professionals who lead self-help groups. Rather, they are simply groups of people who want to share a common, or who do share a common problem and want to meet with other people. Alcoholics Anonymous, Narcotics Anonymous are two examples. Now, sometimes people can get great supports knowing that they're not alone and that the struggle that they experience is shared by other people. And that can be a really, really important big step. Now, we're going to check out the behavior therapies and essentially unlearning old behaviors and learning new behaviors to replace them. So we're going to look at first are the operant conditioning techniques. Now, if you remember from the behavioral perspective, there's operant and classical, and we're going to look at both of them. We'll start with the operant. Behavior modification is a technique which uses the principles of operant conditioning, classical conditioning, and observational learning to replace inappropriate or maladaptive behaviors with more adaptive ones. The goal here is to change the troublesome behaviors, but not change the individual's personality or search for a cause of the problem behavior. The therapist is an active and directive. One example are what are known as token economies. Token economy is one behavior modification type program, and it's used much in schools. However, they're not often well designed or used appropriately. And that's a common flaw with token economies, and chances are you've had some experience in seeing them. Maybe you've participated in them with school or with your own children, but they need to be designed correctly and used and applied correctly, and oftentimes they're not, which is why they don't always work very effectively. Now, token economies, they encourage desirable behaviors by reinforcing them with tokens. Now, tokens can be later exchanged for desirable objects, activities, or other privileges. Now, tokens could be things like bingo daubers for making marks, or bingo chips, or gummy bears, or whatever you want. Maybe not gummy bears. But the idea is that when I do what I'm supposed to do, I get a token for every time I've done the desirable behavior. And then later in that day or that week, I can take my tokens and cash them in for these objects, activities, or privileges. Now, this can be really helpful. However, it needs to be designed and implemented consistently, and it needs to be well defined in its expectations in order to be effective. And there's where sometimes things fall apart. Now, a technique that's predominantly for children is also following this behavior, which is known as timeout. And it's used to decrease undesirable behavior by removing the individual from all reinforcement for a period of time. Now, they suggest, 1 minute for every year of age. It's not a precise science, and it's maybe not even the best solution for problem behavior. It is just a solution, and I would bear in mind that it's not necessarily the most reliable. Now, we'll look at some more the behavior therapies that are based on more classical condition. And these include systematic desensitization, flooding, exposure and response prevention, and aversion therapy. And I'll touch on those too. Therapists using systematic desensitization now this is often used for phobias, but not exclusively. And what they do with the systematic desensitization is they train clients in deep muscle relaxation and then have them confront a series of graduated, very low anxiety producing to very high anxiety producing. So graduated anxiety producing situations, either real or imagined, until they can remain calm and relaxed in the present, even the most feared situations. So a systematic desensitization might be a series of less provoking, might be something like a stuffed animal that looks like a spider, or a cartoon drawing of a spider, working all the way up to high anxiety producing, which might be a real life spider on my hand, like a tarantula. And that the therapist would gradually move me through these as I use the deep muscle relaxation and breathing techniques to manage my stress in these high evoked situations, and that can make a huge difference. Now, the hierarchy of anxiety-provoking situations, real or imagined, are presented low to high, and the individual remains as relaxed as they can, gradually moving from lower to higher anxiety-producing situations. Now, flooding, clients in this instance, these are exposed to the fear object or event, or are asked to imagine it vividly for extended periods of time until their anxiety decreases. So in this case, instead of gradually increasing to get a spider in my hand, they're going to plop a spider in my hand, and I'm going to manage my anxiety for as long as I can. And if it's 2 seconds, then the spider comes off, and I go, whew. Then I do it again, and the whole idea is to increase the amount of time I can do that by getting used to and sort of managing my emotions over time. This way, rather than graduated exposures, they are exposed to higher anxiety-producing situations all at once, and over time, the individual adapts. And then we can look at exposure and response prevention. Now here, people with obsessive compulsive disorder are exposed to an anxiety-producing stimuli, maybe a dirty sink or dirt in a bucket, and are gradually increase the time that they begin their compulsive rituals. Thus, they learn to tolerate the anxiety. So if I see this dirty sink, I need to learn to control my anxiety, to delay the cleaning or the ritualistic behavior for as long as I can, and over time I might be able to actually eradicate it. Now, the last of this group of conditional learning is aversion therapy. Now, aversion therapy is an undesirable behavior is paired with painful, something sickening, or otherwise adversive. So if you've been on a smoking patch, the whole point of that is every time you smoke a cigarette, you get feel a bit sick. And the idea is to create an association between that feeling of sickness and the behavior of smoking, such that that will eventually break. If all I think about when I want to smoke is sickness, then maybe that helps me out. And ultimately, the treatment continues until the bad habit loses its appeal because it's become more associated with pain and discomfort. Now I'm going to touch base on observational learning contributes to and using a thing called participating modeling. In participant modeling, an appropriate response is modeled in graduated steps, and the client is asked to imitate each step with the encouragement and support of the therapist. It's sort of a do as I do philosophy. Now we'll just touch on the cognitive. Now, as you can remember, I suspect, is that cognitive is sort of relearning and being aware of faulty thinking and replacing it with improved thinking. And we're going to look at two, Ellis's rational emotive therapy and Beck's cognitive therapy. And we'll also look at, just briefly, Donald Michelbaum's cognitive behavior modification. And let's start with cognitive therapies by saying that they orientate towards teaching the client how to think, how thinking may be distorted, and help the client see how they're inaccurate, or see how inaccurate some of their beliefs may be. Now, some of the cognitive distortions in thinking include arbitrary inferences, selective overthinking, overgeneralization, magnification, minimization, personalization. There are many. Cognitive behavior therapies are action therapies that work at changing a person's illogical or distorted thinking. There's 3 goals of cognitive behavior therapy are to relieve the symptom and solve the problems, to develop strategies for solving future problems, and to help change irrational and distorted thinking. Now, Ellis's rational emotive behavior therapy is a very directive behavior in which the therapist challenges the client's irrational beliefs, often arguing with the client, even assigning the client homework. Now, Ellis uses an ABC as a model to assist people in this method. Let's look at each one. A is representative of, refers to the activating event, the antecedent, what precedes the belief or the behavior. B refers to the person's belief about the event. That's either the rational belief or the irrational belief. And then C, this refers to the emotional consequence. So it works that way. You're looking at what are the antecedents or the activating event, what the belief that arises out of that is, and what's the emotional consequence that might be supporting that irrational belief. Now, moving to Beck's cognitive therapy, this helps people overcome depression and anxiety disorder by pointing out irrational thoughts that are causing them misery and by helping them learn other, more realistic ways of looking at themselves and their experience. So for this cognitive behavior therapy, the components involve what we think affects our behavior. Cognitions may be monitored and changed. And third, this is an interesting one to me. Desired changes in behavior can be achieved by changing cognition. So you can behave your way into a new way of thinking, or you can think your way into a new way of learning. The cognitive behavior is saying we can change your thinking by changing your behavior. So if I'm depressed and I'm laying on the couch, maybe it would be better to get me up and walk around outside. That change of behavior might start to change my thinking. Now, a relatively new treatment, it emerged in around 1989 by Francine Shapiro. It's called EMDR, or Eye Movement Desensitization Reprocessing. Eye movement desensitization and processing involves moving the eyes back and forth rapidly while concentrating on a disturbed thought. Now, the disturbing thoughts are supposed to be controlled or eliminated by this process. Although the studies seem to show that this is effective in treating stress and anxiety, other research has found that it's not always effective and criticized the way that recovery is measured in the supportive study. So really the ultimate component here is more research needs to be done. Now, last but not least, and I'll see if we can fit this in. Okay. Last but not least, we're going to look at the biomedical therapies. Now, these therapies are used by those who view psychological disorders as having a physical cause underlying it. And there are 4 treatment categories. There's drug therapy, electroconvulsive therapy, transcranial magnetic stimulation, and psychotherapy, and psychosurgery, and we're going to look at all 4. Drug therapy can be very helpful in relieving the symptoms of schizophrenia, depression, bipolar, anxiety disorders, and many other do benefit, but maybe to a lesser degree. Antipsychotic drugs or neuroleptics control the major symptoms of things like schizophrenia in particular, in inhibiting the activity of dopamine. They also reduce restlessness, agitation, and excitement. Antidepressant drugs are used in treatment of depression, generalized anxiety disorder, panic disorder, agoraphobia, and obsessive compulsive disorder. Now, these include tricyclic antidepressants, selective serotonin reuptake inhibitors, or the SSRIs, and it also includes the monoamine oxidase inhibitors, or the MOAIs. Let's break down each one just briefly. Neuroleptic drugs work to inhibit the activity of dopamine. Tricyclics, they block reuptake of norepinephrine and serotonin. Selective serotonin reuptake inhibitors, they block reuptake or serotonin. The monoamine oxidase inhibitor blocks the activity of an enzyme that breaks down norepinephrine and serotonin. Lithium, as mentioned earlier, is a natural salt that evens out moods and decreases severity of mania and depressive episodes in bipolar disorder. Tranquilizers, now these are central nervous system depressants, and they get used periodically. Anti-manic drugs are used to treat bipolar disorders and include lithium and certain anticonvulsant drugs. Minor tranquilizers are known as benzodiazepine are used to treat anxiety disorders. Sorry about that. So now we'll move to electroconvulsive therapy, or ECT. ECT is a treatment of last resort for people with severe depression or for a manic patient who has not been helped by lithium. It's most often reserved for those who are in imminent danger of self-harm. ECT today is administered to the right hemisphere only, and it's called unilateral ECT, one side, which leads to less cognitive damage than the past using the bilateral ECT. In order to be effective, the patient must have a seizure that lasts between 30 and 60 seconds. There is a side effect, and some of that side effect is loss of memory. It has had some very good effect in these rare instances, but it's also very risky. The transcranial magnetic stimulation, or TMS. TMS creates an electromagnetic field that is directed towards the patient's left hemisphere. Now this hemisphere is responsible for emotion for the most part. And the stimulation is meant to activate the underactive or overactive parts of the targeted area of this side of the brain. Now, psychosurgery is brain surgery performed strictly to relieve severe, persistent, and debilitating psychological disorders. It's controversial, as you can imagine. Psychosurgery is basically brain surgery. And so one of the earliest psychosurgeries was known as a prefrontal lobotomy, in which the front part of the brain, or the frontal lobe, was cut away from the back. And this produced a wide variety of outcomes, some desirable, symptoms reduced, but also could end up with a lack of emotional response and intellectual disability. It was a very high risk. Modern psychosurgery includes the bilateral cingulotomy, where electrodes are used to destroy the cingulum, a small bundle of nerves connecting the cortex to the emotional centers of the brain. Now, this treatment is used to treat major depression, bipolar disorder, and certain forms of obsessive-compulsive disorders that have not responded to any other form of treatment. And maybe it's occurred to you through this, with all these different therapies, doesn't the role of culture, ethnicity, gender, age, therapist, client, all these variables, all going to affect which therapy would be best for any one individual? And of course it would. And so there are a great number of misunderstandings and misinterpretations that occur, which is why so much time goes into developing individualized strategies by qualified practitioners to have the desired impact. All right. There we are. We're finished the last chapter. All the educational components have been added. Your assignments, I think by now, will have been handed in, and I'll have them graded. And there's just the last test to do, and we're done. So be safe out there, wash up regularly, and take care. Good luck going forward, everybody. Bye now.